Thank you, Mr. Chairman. First, I'd like to thank you and Ms. Black and Mr. Thompson for your hard work, and thank you for bringing this legislation forward today to improve seniors' access to telehealth care services. It's so important that we update our laws and embrace advances in technology. Telehealth services will expand access to health care throughout the country, particularly for those patients in rural communities. I'd like to just touch on another bipartisan issue that I've repeatedly raised before this committee. It's legislation that I've sponsored with Mr. Blumenauer in multiple Congresses to update and improve the Medicare program to support patients with lymphedema. Our bill, Lymphedema Treatment Act, has broad bipartisan bicameral support with 280 co-sponsors in the House, including 75% of the members on this committee. And today, there are nearly 2 million Medicare beneficiaries suffering from lymphedema who need our help. Medicare must be updated to cover the latest standard of treatment for these patient population. It is unthinkable and unacceptable that patients are forced to go without medically necessary compression garments to treat their condition. This is not about one disease. Closing this coverage gap will help patients suffering from over 40 primary rare diseases and many more secondary causes, oftentimes with lymphedema resulting from various cancers. And this is an issue that not only has bipartisan agreement in Congress, but provider groups and patients alike are pleading with us to get this done. The Oncology Nursing Society, American Occupational Therapy Association, and the Lymphedema Advocacy Group submitted comments to the committee seeking a correction to the lymphedema coverage gap as a part of the red tape initiative. And provider organizations like the American Medical Association and American Physical Therapy Association, among others, in addition to clinicians from the Mayo Clinic, MD Anderson, and James at Ohio State University, have endorsed the bill and called on Congress to fix this coverage issue for members and the patients they serve. Mr. Chairman, as we pass legislation today to update Medicare and expand access to needed benefits like telehealth services, I look forward to working with you and other members of this committee to build upon these efforts in the coming months and take up and pass legislation to fix the lymphedema coverage gap before the end of the year. I thank you, Mr. Chairman. I yield back.